On October of last year, at a community hospital on a telemetry unit, I took care of an 88-year-old female patient. Her family had brought her in for increased confusion. The patient's history included dementia, high blood pressure, and osteoporosis. Overall, she had been in good health her whole life. Unfortunately, during a CT scan of the head to rule out stroke, the doctors found an inoperable brain tumor. The doctors gave the family an estimated life expectancy for the patient of about 3 months. The family then asked the doctors not to tell the patient of the diagnosis and to let her enjoy the time she had left. This is a case of true dilemma. Do you follow the family's wishes and let the patient go on thinking she's okay and discharged home with no new problems? Or do you tell the patient the diagnosis and the few options she has, knowing she may not even remember the conversation and going against the family's wishes? The stakeholders in this case would be the patient, who is suffering from the diagnosis, the family, who is asking you to keep the secret from the patient, the doctor, who has to decide what kind of treatment the patient is going to have, the nursing staff, who are going to have to keep the secret from the patient while still treating her. In this situation, I collaborated with my fellow nurses to get an idea of how they would handle the situation. Also, my nurse manager to get an idea of legally how we should handle the situation, and the physician was collaborated with to determine how to care for the patient. There could be 3 courses of action in this situation. The first being tell the patient of the terminal diagnosis. This gives the patient the autonomy to make their own decisions in regards to the diagnosis, however, goes against what the family wanted. The second course of action could be don't tell the patient. This gives the family what they wanted, but takes away that autonomy from the patient, and they don't have a say in what the course of treatment could be. The third option would be persuade the family to tell the patient. This gives the family some control over the situation, and it also gives the patient the information. However, the patient could end up suffering from this knowledge, or with the dementia, not even remembering the conversation. In the real situation I encountered, the physician decided not to tell the patient the diagnosis and go along with the family's wishes. I believe this was the right choice in this situation, as with the patient's dementia, she may not have remembered the conversation, and the family would have to tell her over and over of the terminal diagnosis. The ethical principles that are brought up in this situation are beneficence. The physician thought he was doing what was best for the patient by not telling her of the terminal diagnosis. However, we can also argue that autonomy is involved because the patient was not given all of the information to make an informed decision. However, the family made the decision for her. The systemic review I chose talks about how important it is for family involvement in the decisions for healthcare regarding dementia patients. This helps to justify the physician's actions in going along with the family not wanting to tell the patient about the terminal diagnosis because they chose that that was the best course of action for their mother suffering with dementia. The self-care deficient theory by Oram could argue that this patient should have been responsible for their own care. She should have been informed of the terminal diagnosis and been able to make her own choices, whether that be trying an experimental treatment or going into hospice. However, the family made that decision for her. The non-nursing theory that could be applied to this situation is Lazarus's stress and coping theory. This theory can argue that the family was preventing the patient from a stressful situation. By not telling her the terminal diagnosis, the family helped the patient to avoid the stress, therefore letting her live the rest of her life in happiness. And I now ask you, how do you feel about this situation? Do you believe that the patient had the right to know about her terminal illness, or do you believe that the family was doing what they thought was best for the patient?